morning, everybody. Can I have everybody's attention? I welcome you all to Anastomosis Day 2 on our senior quiz. And amongst us, we have our beloved teachers, Dr. Sumer Sethi.
Dr. Sumer Sethi is an eminent radiologist, entrepreneur, blogger, innovator, TEDx speaker, and motivator who has not only done pioneering work in his field but has mentored lakhs of medical graduates in the last 2 decades. Sir did his MBBS from the highly reputed Maulana Azad Medical College, followed by a 1-year rotatory internship there and associated Lok Nayak Hospital, GB Pant Hospital, Guru Nanak Eye Center, New Delhi, India, and he did his residency from the prestigious Lady Hardinge Medical College. He has worked as a consultant radiologist in various hospitals in Delhi, including Indian Spinal Injury Center and WIMHENS, before taking the full-time entrepreneur role. Sir has been a recipient of many awards and honors. A few to mention: Digital Bharat Award for his website TeleRad Providers in 2015. He has been featured as one of the radiology top 25 most influential in RT Image magazine for 2007. He was included in Iconic Doctors list by Daily Rounds in 2016. He has also been awarded the Sri M.L. Garg Memorial Medal for the Best Senior Resident in Radiology in 2004 and invited faculty member at various conferences including Teleradiology in IRA 2008, 11, 13, 14. He has been visiting international faculty member of Tripoli Universities, Libya. In 2012, IRIA, he was invited to speak on entrepreneurship in radiology. In 2019 and 2020 conference, he spoke about radiology educational changes required for the new generation. Besides all of the aforementioned accolades, respected Sir is perhaps most well known for his position as CEO at Delhi Academy of Medical Sciences, DAMS. DAMS is a coaching platform that caters to medical students preparing for various exams, including but not limited to NEETPG, NEXT, USMLE, PLAB, etc. Its renowned reputation needs no further elaboration. The Academy has certainly made a name for itself in the student community. It's accessible, affordable, and a trusted resource for many amongst us. We welcome you, sir. Thank you for gracing this occasion.
Dr. Deepti Bahl ma'am, MBBS, MS Obs Gyne from LHMC, Delhi. Worked as a senior resident in LHMC for 3 years and then joined private sector and worked as a consultant in infertility in Fortis, Noida. She is a dedicated educationist and considered as the top faculty for Obs Gyne in India. She has delivered talks in various conferences of national and international repute. She heads the academic and management team of DAMS and brings the emotional quotient to the company. Lady doctors and women entrepreneurs look up to her as a role model. In her role as a director of DAMS, she believes in leading from front and believes that education serves a higher purpose and is not just business. Thank you, ma'am, for gracing the occasion. Volunteers in place?
Yeah. Senior finals too.
हाँ जी, एवरीबडी वेरी वेरी गुड मॉर्निंग एवरीबडी, गुड मॉर्निंग। हाँ, मुझे ऐसे लगा कि क्विज शुरू करने से पहले मैं एक बार सब बच्चों से बात कर लेता हूँ। सबसे पहले मैं चाहता हूँ आप में से कितने बच्चे फर्स्ट ईयर एमबीबीएस हैं, हाथ खड़ा कर दो। शाबाश। सेकंड ईयर एमबीबीएस, हाथ खड़ा कर दो। शाबाश। क्विज वाले बच्चे, शाबाश। अच्छा, जो फर्स्ट ईयर में अभी आए हैं, अभी ये वो वाले बच्चे तो नहीं जो कल ज्वाइन किए हैं, या वो अभी पिछले वाले फर्स्ट ईयर वाले ना? हाँ, नए वाले भी हैं? कितने बच्चे जो अभी जस्ट मेडिकल कॉलेज में घुसे हैं? बाय गॉड, वेरी गुड। अच्छा, अब मैं चाहता हूँ इन सबको, वी विल वेलकम देम ऑल विद अ ह्यूज राउंड ऑफ अप्लॉज, है ना? ठीक है। अच्छा, एक बात बताओ कि जब कॉलेज में पहले दिन आए थे और जब दूसरा दिन हुआ, क्या उसमें कुछ फ़र्क था? मैं बस याद कराता हूँ आपको, पहले दिन आप आए थे ना, तो आप कह रहे थे मुझे हार्ट ट्रांसप्लांट करना है। याद है मुझे? मतलब फिर सीनियर ने थोड़ा समझाया कि नहीं भाई, थोड़ा सोच। फिर आपने बोला नहीं, मुझे तो मतलब HIV का इलाज ढूंढना है, या ऐसे मतलब बहुत बड़े बड़े बात थी आपकी। सेकंड डे क्या होता है, थोड़ा रैशनलाइज करना शुरू हो जाते हैं। धीरे धीरे क्या होगा, मैं चाहता हूँ आपको एक आइडिया दूँ। धीरे धीरे जैसे जैसे आप कॉलेज में आगे बढ़ोगे, आपको ये पता चलेगा कि जो आपने सपना देखा था वहाँ पहुँच गए हो, लेकिन पहुँचने के बाद और काम करना पड़ रहा है। ये वैसे ही है जैसे एरोप्लेन जब ऊपर राइज कर रहा होता है तो उसको लगता है मैंने बहुत सारा फ्यूल बर्न कर दिया, अब ऊपर जाके आराम करेंगे। ऐसा होता नहीं, हाइट पे जाके और मेहनत करनी पड़ती। उसी तरह से जब आप स्कूल से मेडिकल कॉलेज में आए हो, आपको उसी तरह से अब यहाँ और मेहनत करनी पड़ेगी। जब आप और मेहनत कर रहे होगे ना, थोड़ा डिसइल्यूजनमेंट होगा कि यार सही किया मैंने, ये तो बहुत पढ़ना पड़ रहा है ना? फिर आप थोड़ा सा कंफ्यूज हो गए। उसको मैं सेकेंड ईयर या थर्ड ईयर सिंड्रोम बोलूँगा, कि वहाँ पे ऐसा होता है कि लगता है कि सही, पता नहीं सही जगह आया भी कि नहीं आया, ऐसा लग रहा होगा। मैं लेकिन एक चीज़ आपको रीअश्योर करना चाहता हूँ, और आप इसको दोबारा से भी सोचना, जब भी बीच में कंफ्यूज हो, लगे गलत हो गया, याद कर लेना, बहुत अच्छे प्रोफेशन में आए हो। यू आर इन राइट प्रोफेशन। लोग बोलेंगे, आप अगर इंटरनेट पे पढ़ोगे, कोरा पे पढ़ोगे, सोशल मीडिया पे पढ़ोगे, तो आपको ऐसा लगेगा कि बहुत सारे इन्फ्लुएंसर ऐसा बोल रहे होंगे कि ख़राब है मेडिकल प्रोफेशन, आप घबराओगे भी। लेकिन ये सोचना वो खाली फॉलोअर बढ़ाने के लिए कर रहे हैं, ठीक है? डॉक्टर मेडिकल प्रोफेशन बहुत अच्छा प्रोफेशन है। मैंने आज के समय से ज़्यादा बेहतर टाइम नहीं देखा डॉक्टर होने के लिए। आज मेडिकल साइंस, टेक्नोलॉजी, और मतलब इवन अगर मैं उनका एक मिश्रण सोचूं, एक मिक्सर सोचूं, आज मेरे साथ मैं इतने सारे लोग जानता हूं जिन्होंने डिजिटल हेल्थ केयर एंटरप्राइज बनाए हैं। मतलब डिजिटल हेल्थ केयर मिला के एंटरप्राइज बनाए हैं। ऐसे में बहुत सारे लोग जानता हूं जिन्होंने रिसर्च के अंदर, आप बच्चे उस समय स्कूल में थे, लेकिन आपने अपने सामने देखा है साइंस की ताकत को, कि कोविड एक नया बीमारी आई, उसकी वैक्सीनेशन भी बन गई। उसकी वैक्सीनेशन भी बन गई, और वो हिस्ट्री में इतनी तेज़ कभी वैक्सीन नहीं बनी थी। तो जो भी कभी कभी क्या होगा, जब हम अपने इमीडिएट सराउंडिंग में देख रहे होंगे, लग रहा होगा कि कुछ बड़ा नहीं हो रहा है, लग रहा होगा नहीं यार ये क्या, मैं क्या कर रहा हूँ, मैंने तो बहुत बड़े सपने देखे थे। लेकिन जब आप धीरे धीरे बड़ी पिक्चर सोचोगे, बहुत कुछ हो सकता है। आप एक बहुत सही प्रोफेशन में। मैं अगर अपनी ही जर्नी को लूँ, एक 2 मिनट की लेके, मैं आई थिंक आई हैंड ओवर डॉक्टर दीप्ति फॉर द फर्स्ट राउंड। मैं जानता हूँ कि आप फर्स्ट ईयर बच्चे, कई सारे क्विज के अंदर आप हो सकता है रिलेट भी ना कर पाओ कि जो क्वेश्चन पूछे जा रहे होंगे, लेकिन कोशिश करना कि ये सोचना कि ये क्या पढ़ने का ये तरीका हो सकता है कि गेम में पढ़ भी लें। यही हमारी कोशिश भी होगी आज कि हम क्विज के साथ गेम के अंदर पढ़ भी लें, कुछ सीख भी लें, है ना? तो आपको लगेगा, जब बच्चे छोटे वाले होंगे, लगेगा यार ये मेरे को नहीं आता, ये तो सब्जेक्ट ही बड़े मुश्किल हैं। लेकिन ये सोचो कि हार जीत नहीं है, खेलना ही ज़्यादा इंपॉर्टेंट है, खेलना ज़्यादा इंपॉर्टेंट है। मैं मेरे समय पे, मैंने जब PMT का एग्ज़ाम दिया था, मैं एक साधारण घर से आता हूँ, मैं जब मैंने PMT का एग्ज़ाम दिया तो मुझे कुछ भी नहीं पता था कि PMT होता क्या है। बस मुझे ये पता था कि NCERT की किताबें पढ़नी चाहिए क्योंकि गवर्नमेंट ने बोला है। मतलब समझ पा रहे हैं, मैं उस समय पे ऐसा बच्चा था जिसको कुछ नहीं पता था कि रैबिट पढ़ना है कि फ्रॉग पढ़ना है, लेकिन मुझे ये पता था कि उस समय पे NCERT किताब पढ़नी की सरकार ने बताई, हमने वो पढ़ ली। मैं जब एग्ज़ाम दे रहा था मेरा PMT का, तो मुझे बहुत सारे क्वेश्चन के आंसर आते थे। मैं सोच रहा था कि मेरे ऐसा क्या मैंने किया कि मुझे आंसर आते हैं। एग्ज़ाम के दिन मैं सोच रहा हूँ ये तो आंसर क्यों कर पा रहा हूँ। बाद में वापस आया, जब मेरा ऑल इंडिया 4 रैंक आ गया उसके अंदर, तो आई रियलाइज्ड कि वो NCERT से पेपर आ रहा था। तो मैं ये आपको आज बताना चाहता हूँ कि आप भी आज जब पढ़ना शुरू करोगे मेडिकल कॉलेज में आने के बाद, आपको ऐसा लगेगा कि यार कोई शॉर्टकट तो नहीं है, कुछ नहीं है। लेकिन मुझे लगता है जो अगर कॉलेज में अच्छी किताबें पढ़ोगे, अच्छा बेस बनाओगे, तो ज़्यादा अच्छा कर पाओगे एज़ कम्पेयर टू आप मल्टीपल MCQ इकट्ठे करते जाओगे। उसकी जगह आप बेस अच्छा बनाओगे, अच्छा कर पाओगे। सही किताबें हमेशा ज़्यादा मदद करती हैं। जैसे स्कूल के समय में NCERT किताब थी। जब मैंने MBBS कर रहा था मौलाना आज़ाद मेडिकल कॉलेज में, तो मैं उस समय पे भी एवरेज ही स्टूडेंट था कॉलेज में, मैं एवरेज स्टूडेंट था, मैं कभी कोई डिस्टिंक्शन नहीं आया, कोई गोल्ड मेडल नहीं आया कॉलेज में। लेकिन उस समय पे मैं बहुत सारे समय पे ना मेरे को आदत थी कि नोट्स बनाता था, क्लास में पढ़ा नोट्स बना लिया, किताब पढ़ा नोट्स बना लिया, नोट्स बनाता था मैं। ऐसा लगेगा मतलब कि बड़ी छोटी सी बात है अपने हाथ से नोट्स बनाना, मतलब, लेकिन आज आप देखोगे बहुत सारे लोग आपको बने बनाए नोट्स बेच रहे होंगे। आप बाजार में जाओगे ऐसा लगेगा कि दुकान लगी हुई है नोट्स बेचने वाले की, मतलब प्रिंटिंग वाले, पायरेटेड वाले, हर तरह के नोट्स बेच रहे होंगे। मेरा मानना है कि नोट्स खुद बनाने चाहिए। मैं थोड़ा सा ट्रेडिशनल मानना है, मैं वहाँ नोट्स बनाता था अपने कॉलेज में बैठ के। मेरा इंटर्नशिप जब शुरू हुआ, हमारा इंटर्नशिप बिजी होता है एमसी के अंदर, तो उस समय पे जब मैंने मेरा पीजी का एग्ज़ाम दिया तो मैंने अपने सिर्फ नोट्स को ज़्यादा पढ़ा क्योंकि टाइम ही नहीं था। बाकी लोग पता नहीं क्या कर रहे थे, मुझे लगा वो अच्छा कर रहे होंगे क्योंकि सारे होशियार थे मेरे से ज़्यादा। लेकिन फिर मेरा ऑल इंडिया 4 रैंक आ गया, फिर मैंने एमडी रेडियोलॉजी ज्वाइन किया। तो दूसरा लेसन मैंने सीखा, मैं आपको बताना चाहता हूँ, अच्छी किताबें पढ़ो, नोट्स बनाओ, नोट्स बनाओ, लाइव क्लास में बैठो, टीचर के साथ क्लास में पढ़ो। डैम्स एक हमारा जो प्लेटफॉर्म है, यहाँ पे हमारी 2 यूएसपी हैं, एक्चुअली 3 है। एक के हम इंडिया के इकलौते फेस टू फेस क्लासरूम है जहाँ पे फेस टू फेस पढ़ाया जाता है। ज़्यादातर लोग आज प्री रिकॉर्डेड सामान एमबीबीएस के स्टूडेंट्स को देना चाहते हैं। उनका मानना है कि एमबीबीएस का स्टूडेंट रिकॉर्डेड लेक्चर को पढ़ सकता है। मुझे ऐसा लगता है कि टीचर को पढ़ाना पड़ता है, तो मैं फेस टू फेस क्लासेस का एक ही हम प्लेटफॉर्म है। दूसरा हमारा मोबाइल ऐप है जिसने अभी रिसेंटली 1 मिलियन डाउनलोड्स क्रॉस किए हैं हमने, 1 मिलियन। और हमने अभी पीएम हमें कोविड के समय पे 2020 में पीएम मोदी ने इसको टॉप 5 एजुकेशन रिसोर्सेज के अंदर इंडिया के अंदर रेट किया था। ई-मेडिकोज नाम है हमारे प्लेटफॉर्म का। ये एक ही ऐसा प्लेटफॉर्म है हमारे सेक्टर में जहाँ ऐप पे लाइव क्लास होती है, बाकी सब प्री रिकॉर्डेड होते हैं। मतलब ये हमारे 2 यूएस में। तीसरा, मैं हमेशा कंसाइज बात को विश्वास रखता हूँ। मैं हमेशा एक ही चीज़ चाहता हूँ कि टीचर का काम फैलाना नहीं है सामान को, टीचर का काम है सामान को समेटना। और ये आप अपने सीनियर से भी पूछेंगे जो, और अगर आप चाहें तो इंटर्न से, आपके सीनियर, सुपर सीनियर से, जिनसे अभी आप बात न करें, अभी आप नए नए आए हैं, थोड़े टाइम बाद ही आप इंट्रोडक्शन करें तो और अच्छा रहता है, नहीं तो रैगिंग भी हो सकती है आपकी। लेकिन जब आप अपने सुपर सीनियर से दोस्त बन जाएंगे, जब आप उनसे पूछेंगे तो सब बताएंगे कि बहुत सारे रिसोर्स ऐसे हैं जो बहुत कुछ फैला सकते हैं, समेट सिर्फ हम ही पाते हैं, है ना, सिर्फ डैम्स कर पाता है। ये हमारी स्ट्रेंथ है, क्योंकि बचपन से मैं यही चीज़ सीखी है मैंने। सही किताब पढ़ो, नोट्स बनाओ, क्रिस्प कंसाइज रखो, टीचर स्टूडेंट को रिलेशनशिप के अंदर एक ऐसा रिश्ता हो जहाँ हमें बच्चे के सक्सेस पे खुशी मिले। मेरा सक्सेस तब है जब आपका सक्सेस हो, ये मेरा प्लान है, ये मेरा थॉट प्रोसेस है। और क्विज मेरे हार्ट के बहुत ही करीब है, मतलब मैं ऑलमोस्ट पूरे दिल्ली में ऑलमोस्ट हर क्विज का मैं पार्ट बनना चाहता हूँ, क्योंकि क्विज मुझे बहुत ही पसंद है। क्योंकि कंपटीशन में जब हम खेलते हैं तो एक जो बच्चे खेल रहे हैं वो भी सीखते हैं, जो हार रहा है वो हार नहीं रहा वो भी सीख रहा है, जो जीत रहा है उसका कॉन्फिडेंस आ रहा है, ऑडियंस भी सीख रहा है ना। तो आई विल इनवाइट डॉक्टर दीप्ति टू डू दी फर्स्ट राउंड, है ना।
Right, very good morning to all of you, and thank you to the organizers for giving a very sweet introduction for us, and we feel honored to be here. And without taking much time, I'll start with the first round. But yes, अभी आप डॉक्टर सुमेर से मिले, जो कि कैसे टाइप के बच्चे थे? टॉपर टाइप के। अब आप एक ऐसे टाइप के मैम से मिल रहे हो जो शायद टॉपर टाइप की नहीं थी मगर फिर भी टॉप किया। ये कैसे होता है? क्योंकि ज़्यादातर हम सब अपने आप को एक लेबल देते हैं। क्या है वो लेबल? एवरेज। यस, दैट्स अ वेरी कॉमन लेबल दैट वी ऑफ्टन गिव आवरसेल्व्स, दैट वी आर एवरेज, वी हैवंट टॉप्ड, वी हैवंट गॉट डिस्टिंक्शंस। ठीक ठीक कर लेते हैं मैम, क्या हम भी फर्स्ट अटेम्प्ट में फोड़ पाएंगे? तो क्या फोड़ पाओगे? Yes, and what is the key behind that? The key behind that is consistency. The only thing that actually makes toppers above average and exceed and do very well is that average students don't know where to stop. Okay, and just because they don't know where to stop, they keep going on and on and on and on. And the sooner you start, the more consistent you are, without getting stressed. अगर हम कुछ घंटे dedication से दें, that can also be just 1 hour, but you just be mentally present where you are physically present. ये कुछ चीज़ें हैं जो अगर अभी से सीख लोगे तो you'll stop labeling yourself as average or below average. So ये label अपने आप को नहीं देने हैं. You are in a new space. It is your college. You have to show how great you can be. Yes, कॉलेज का नाम उनके बच्चों से होता है, इट्स नॉट द अदर वे राउंड. Yes, so are you going to make your college proud? Arre? Yes, ma'am, बहुत जोर से आना चाहिए. Yes, and I'm sure that each one of you is very, very capable. आप अभी first year में हो, and I'm sure आपको भी अपना potential नहीं पता है. So explore. You're going to be brilliant doctors, wonderful minds, and I'm sure that you're going to all exceed in various branches and give a lot to the society and also do good for yourself. Yes, so it shouldn't be like वो कौन सा ब्यूटी पैजेंट होता है जिसमें कुछ 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 बोलते हैं और एंड में क्या बोलते हैं वर्ल्ड पीस. हाँ, सो सोशल सर्विस नहीं कर रहे हैं हम, जो भी कर रहे हैं वो हम अपने लिए कर रहे हैं. दिस इज व्हाट यू हैव टू लर्न. Whatever you're going to do to improve your own self, और in return social service अपने आप हो जाती है. एक डॉक्टर के लिए सबसे अच्छी social service क्या है? That when we are good at what we do. Yes, that's what it is. So when you become the best at what you do, you believe it or not, you are doing a social service. आज की डेट में social service है दिल से काम करना. And if you're good at what you do, you're already making a big, big impact and a big difference. Yes? So each one of you, all the very best. You're embarking on a new journey. This might seem a little difficult and you have some bright minds sitting here. But don't worry, you are going to replace them, and you know, every senior will have a successive generation who's smarter than them. Yes, so for example, all these bachas have, you know, shadowed us and they are bright and sitting here, and I'm sure ye aur bhi अच्छे kaam karenge. So let's start off. So the first round is going to be a clinical case scenario round, and these are the rules. So I'm going to read out the questions. The questions are a little lengthy, so I might just read out some keywords for you, but the questions would be displayed. We are going to start from team 1. So team 1, can you raise your hand, please? Great. And can we ask them to introduce? Yeah. So why don't you introduce yourselves, bache, quickly? Okay, Manav from MAMC. A big round of applause for Manav. Great. Hanji beta. Very good. So Aditya from MAMC from final year. So again, a big round of applause. All right. So team 2. Great. Welcome Keshav. All the best. Kritika from HIMSR from final year. So great, great. All the best. Team 3. Great. So, yay. Okay, I'm a little biased, but then it's okay. Huh? Great. So, welcome Dhanshri. And team 4? Okay. Great. So, a big round of applause. All the best, Zareen. Shivangi, all the best. Okay. All right, Akriti, all the best. Great. Aditi, all the best, bache. And now we move on to team 6. Yes, boys. Ansh, all the best. Harsh, all right, I'm sorry. Harsh, all the best. All the best. So great, great, great. So I'm sure it's going to be a good round. So you'll be given 1 minute to answer the question. Okay, and they want you to raise your hand when you're answering so that the mic can be handed over to you. Please do not prompt the home team specially. Yes, and I think each question has 3 parts, bache. Every part has 10 marks. And if you answer it partially, we'll give you 50% marks. There are no negative marks. There is no passing of the question to the other team, right? Okay, so can we start off? Team 1, are you ready? Oh, okay. All right. So yes, rules for the Pounce team. So you will start when we say start, and your time ends at 45 seconds. Again, you have to answer all the parts of the question. Okay, again, no negative marking, and as mentioned, 50% marks for partially answering it, right? For Pounce, yes.
So questions will be given in the order of ranking so far, and we will direct one question. For example, I'm directing a question to you. You will have 1 minute to answer that question, but the question is open for all the 5 teams for Pounce. The Pounce starts when for 45 seconds. Pounce will start First, ma'am will read the question. Then, when the questions are displayed, the actual questions you have to answer, then the pounds and the timer will start. Rest of the teams will have 45 seconds for pounds. Your pounds should have all the parts, no negative marking, correct answers 50%. Direct team, you will get 1 minute to answer. All answers, no negative marking, full marks for you. Maximum score you can get from each question is 30, and for correct pounds, maximum score you can get is 15. And you have to, for pounds, write the answers on your sheet and tell your volunteer. Every team has a volunteer. Your volunteer will check the answer at 45 seconds and we will let you know. No prompting. Any prompt will disqualify the pounds for that round, and the winning team will get the score if they answer correctly.
On the second slide. Exactly. All right, team 1. So the question for you is, a 69-year-old male with left-sided secondary weakness due to transient ischemic attack. A chest X-ray shows bilateral fine reticular and reticulonodular opacifications. There are some sclerotic changes in the in the humeri. Okay, there is interlobular septal thickening and ground glass classification. Diffuse perinephric soft tissues around both kidneys with additional soft tissue within the region of both renal pelvises, and mild dilatation of the intrarenal collecting system or hairy kidney. Yes? Okay, coarsened trabeculae with mixed pattern of dense sclerosis. Some of the findings of IHC analysis have been provided to you. It is CD68 positive, CD1A negative, and S100 negative. So your question is, first, name the disease and the mutation. The disease was featured in a famous medical TV series. Yes? Name the main character.
Your palms window starts now. Arms is open for 45 seconds.
So those are the findings. I'll keep showing the question again.
Palm window closes. Timer. Timer.
They- So is 1 minute up?
5 for plus 5 for team 2 and team 2 and team 3.
Tuberous sclerosis.
All right. Let's hear team 1 out. Yes, team 1.
Tuberous sclerosis and mutation of Hamdard gene.
All right. Unfortunately, that is not the correct answer, bache.
Second part also. House and Gregory House.
So they got the third part correct? Yes? All right. So they got one part correct out of the 3 parts. So, all right. Are we ready for the answer now? So your answer is Erdheim-Chester disease. Yes? What is it? It is a rare form of Langerhans cell histiocytosis, and it's characterized by xanthogranulomatous infiltration. Okay, and the mutation that we were talking about is BRAF-E. Okay, so it's a BRAF-E mutation, and I think House MD is what they did mention correctly. So you got one part correct. So a big round of applause. They've opened their ticket. And I think one of the teams got the pounds correct. 3 teams got. So let's just announce them. So which teams have got the team 2, 3, and 4. So they have got partially correct answers. So I think a huge round of applause for team 2, 3, and 4 as well. Okay. Team 2, are you ready? So that is your question. You have a 15-year-old female patient coming to the OPD with complaints since 1 year of a diffuse erythematous papular eruption, primarily in the butterfly distribution of a face. The lesions commenced as red macules over the cheeks and then progressed to involve the entire face. There is pruritus, there is photosensitivity. Okay, so ENT exam, Weber localizing to the opposite ear, Rennie's is negative. They have characteristic features like low set ears and ocular hypertelorism. There is hypertrophic cardiomyopathy, and genital examination reveals underdeveloped labia minora and majora with sparse pubic hair. So your question is, name the syndrome. That's part 1, team 2. Second, the 3 genetic mutations associated with it.
This question में syndrome is for 15 marks and the 3 genes 5 marks each, so 15 plus 15.
The bounce window is closed.
You have more time. You can take your time, team 2. All right, team 2. Hanji.
Neurofibromatosis.
Okay. No, so neurofibromatosis is not the correct answer, bacha. And any of the other teams have got the pounds correct? No. All right. So anyone from the audience wants to give it a try? All right. मुझे लग रहा है हम कहाँ आ गए? हाँ? Okay. So yes, somebody wants to give it a try? Okay, is he right? Yes. So a big round of applause. So that's absolutely right. So what you have to do is you have to expand leopard, and we should definitely give the young boy a gift, young doctor a gift. What is your name, beta? Tanishq. So very well done, Tanishq. Keep shining like your name. So leopard, as I said, you just have to expand. So lentigenes. E stands for ECG conduction abnormalities. Ocular hypertelorism was a direct hint. Pulmonary stenosis, abnormal genitalia, retardation of growth, and SNHL, so sensory neural hearing loss, right? And the genes was definitely a difficult part, but they are used to classify the 3 types of leopard. So as you can see, type 1 is PTP-N11 gene, type 2 is RAF1 gene, and type 3 is BRAF gene, okay? Well tried. So good, keep going, yes, that's how you learn. All right, team 3, are you ready, bacha? All right, girls, all the best. So your question is on the screen now. So this is a 7-year-old boy who comes to the OPD with complaints of walking and increased frequency of falls since childhood, okay? The boy has a history of epileptic disorder and infantile onset of partial seizures. The response has been only to one drug, which is carbamazepine, okay? Ataxia is a prominent feature. The power in the limbs is 5 by 5. Reflexes are normal. Tone and bulk is also normal. There is a psychomotor delay. There is sensory neural hearing loss. There is hypokalemia. There is alkalosis. Okay. Abdominal ultrasound reveals diffuse parenchymal lesions. Name the syndrome, the genetic mutation along with the channel affected.
The palm window is open. The palm window is closed. Time up.
Is 1 minute up? Okay, team 3. All right. No, unfortunately, the answer is wrong, but there's no negative mark. Did any of the teams get the pounds correct? No. Okay, but before I move forward, I think some of the first years, Bichare, have really got disheartened because of the tough questions. Where are the first years? Can you please raise your hand once again? Okay, have you all started with anatomy? No, not at all? All right. What subjects have they started? Nothing? All right, but you've all cleared PMT, right? So at the end of, questions for these, I'll have one question for the Chota Bachas here, and everyone who answers it correct is going to get a gift. Okay? Yes? Are you ready for it? And believe me, I'll make it as simple as possible from your PMT knowledge. Okay? Chalo. So first, let's talk about this answer. So team 3, this is incorrect. Okay? So the answer is East or Sezame syndrome. Okay? Characterized by sensory neural hearing loss, seizures, ataxia, mental retardation, and electrolyte imbalance. Right? Where East actually is epilepsy, ataxia, again sensory neural hearing loss. There's a renal salt wasting and tubulopathy. Right? So that's the answer for this one. Okay. So now let's give a question for the first years. So everyone, are you ready? So what you're going to do is you're going to raise your hand. Whoever knows the answer to the question that I'm going to speak up. Okay, and then we'll give chance to one of the persons to answer. If you do it correct, we give you a gift. If you don't do it correct, we just pass it on to the next person. Yes, first years, are you ready? Yes. All right. So the question for you is, which of the following parts of the fallopian tube is the site of fertilization? Let me give you the options. Hold on, boys and girls. So you're a bright batch. See, they just didn't know what to ask you. Huh? So your options are A, isthmus, B, ampulla, C, fimbria, or D, interstitial part. All right. So first, let's give a chance to the girls. As they say, girls, go first. Let's give them a little respect. Okay. Tell me your name, sweetheart. Asba. So yes, Asba. What's the answer? Excellent. That's the right answer. Very well done. A bright girl here. Please give her a gift. Okay. And whoever will answer maximum correct questions in the first year batch, we will be giving you a special gift from DAMS, as well. So sit here, wait for your questions, and we'll have some special questions for you, okay? So team 4, where are you? Team 4, all right. Are you ready, bacha? Okay. So this lady has been delivered by cesarean section. She had a previous scar because she was operated at 41 weeks. The baby is 2.3, Apgar was 7 and 9 at 1 at 5 minutes. The baby was able to breastfeed, passed meconium as well. The antenatal period had, a significant finding of polyhydramnios and IUGR. Otherwise, it was uneventful. Okay. No history of consanguinity or teratogenic drugs or radiation exposure. Head circumference is 35.5, length is 49 centimeters. There is bilateral shortening of the forearm and radial flexion deformity, hypoplastic left thumb, and an absent right thumb. The lower limbs have no apparent defects. So I think the sucking, rooting reflexes is all normal. There's nothing wrong with the spine. S1 and S2 are heard. No, there's no murmur. Everything else is unremarkable. But the finding on X-ray is absent radius bilaterally. Echocardiography shows a medium-sized membranous ventricular septal defect. Yes? Okay, so your questions are, 1, name the disease. Second, what is the mode of inheritance, beta? And long-term complication if the heart problem is not repaired. So your time starts now. Yeah, sure.
Bounce window is closed. Team 4, you have 15 more seconds.
They got all three right? All three right.
Okay. Team 4. Can you turn on your mic, beta?
So we think the disease is Holt syndrome and the inheritance is autosomal dominant, and we're going to guess the complication to be heart failure, but we are not sure.
All right, so I think I'm going to give you 2 out of those. Okay, so not all 3. Yes, it is Holt-Oram syndrome. Yes, and it is autosomal dominant in inheritance, and the characteristic finding, a complication. Which one did you say? All right, so I'm not very sure if we can give that to you, okay, because it isn't a very specific one. All right, so those are the findings in Holt-Oram syndrome, yes, and 20.
Bounces, team 1 got all correct 15. Team 2 all correct. English 1 correct 5.
Okay,
50s.
great. So can we have one of the answers maybe from the boys? What answers did you give? So yes, the diagnosis is Holt-Oram and it is autosomal dominant. What about the complication? All right, great. So yes, so shunts or pulmonary hypertension is the good answer. So very well done, boys. All right. Okay. Kahan hai chote bacche, first years, raise your hand. Are you ready for your next question? Yes. So have you all heard of Turner syndrome? Who can tell me the correct karyotype? Raise your hands. Karyotype of Turner's syndrome. Only for the first years. Only for the first years. Okay. So now it is time to give chance to boys. We believe in equality. Yes, beta ji. खड़े हो जा, अपना नाम बता दे राजा. What is your name, बच्चा? Adarsh. Okay, Adarsh. And what would be the total number of chromosomes, bacha? So can you give me the complete karyotype?
45 number of chromosomes, 23 plus XO.
All right, so 45 XO, very well done. So huge round of applause. So you are bright people. Yes, when given a chance, you're going to all shine. Okay, so very well done. So team 5, is it team 5's turn now? Yes, are you ready, girls? All the best. Okay. So your question is on the screen. A 15-year-old patient, primary amenorrhea, no excess hair, axillary hair are present, external genitalia are normal. Okay. The findings are height is 162, high LH and FSH, LDH raised, HCG raised, a small uterus. Okay. There is a solid mass containing fine ocular foci without vascularity in the left ovary. Okay. MRI shows a well-defined encapsulated mass lesion measuring 6 into 6 into 5 centimeters in the pelvic cavity adjacent to the uterus. On contrast, there is heterogeneous enhancement, small size of the uterus and hypoplasia of the ovaries. Exploration of the cavity shows an apparently 6 centimeters in diameter malignant mass left ovary diagnosed as high-grade malignancy, probably germ cell. Left salpingo-oophorectomy is done. Tumor marker PLAP, CD117 positive in reactive lymphocytes, negative for CD138, inhibin A, and CD99. Yes? Okay. So your questions are, what is the diagnosis, bacha? What is the management? And can you give us 2 associated genetic mutations?
The Bahl window is open.
All right, yes, I will show you the question. Okay, there are a couple of teams ready for pounds.
Bahl window is closed. Time up.
Any correct answers?
All right. Team 5, I hope you're ready because the time is up. We're just waiting for the pounds teams. Okay. Okay, so 2 teams have given the partial correct pounds, which I'll love to hear out, but let's give chance to team 5. Girls, not a very difficult one. Give it a try. Come on.
the diagnosis, we are not sure, but we think it might be ovarian cancer, ovarian tumor, dysgerminoma. The management may be radiotherapy and pelvic lymph node dissection and mutations.
I think you haven't got the question correct. So see, we are asking you there is an ovarian cancer that's already given to you in the question. So that can't be the diagnosis, beta ji, right? So we are asking you, what is the diagnosis of this patient? Yes? And then what is the treatment of the patient? We've already told you that we've done a surgical management for the ovarian malignancy, right? So do you want to give it a try again?
Sorry,
All right. So it's a good try, but it's an incorrect answer, bache. So let me hear out from the Pounce team. So any one of the teams got the diagnosis correct? No? Come on, we've taught you this. So can you tell me the hint? She's primary amenorrhea. Yes, but the height is normal. And there is high LHFSH, which means there is a problem at the level of the gonad. Yes, so what would it be? Gonadal dysgenesis. Do you know that only in gonadal dysgenesis, the levels of LH and FSH will be high because there is no feedback inhibition. So दो ही तरह के gonadal dysgenesis हैं जो आपको याद रहने चाहिए. एक होता है Turner's, जो मैंने अभी उनसे पूछा. दूसरा Swire's, pure gonadal. So this is actually Swire's. How do you differentiate the two? Swire's में height is normal. So I often say कि जब Swire's याद रखना है, remember them as tall Turners. So बाकी सब same होता है. The karyotype is different. ये 46XY होते हैं Turners, 45XO होते हैं. और दूसरा difference होता है, Turners have short stature, they have a tall stature. Why do they have an ovarian malignancy? Actually, it should be gonadal malignancy. So the dysgenetic gonads have a very high probability of developing cancers, gonadoblastomas as well as dysgerminomas. So they are classically germ cell tumors. Yes? And the mutation is SRY gene. That is the most important one. The other can be MAP3K1 gene. Yes? All right. Sorry? No, it's absolutely fine. So what were the parts that you got correct, boys? The two teams? You got the correct answer as? Yes, gonadectomy. So because it is a dysgenetic gonad, you need to remove the gonad because of high chances of malignancy. So that's fine. So well done, teams, and well tried, team 5. So huge round of applause for the Pounce teams. Okay, so now comes again my favorite chota bachas. So where are the first years? Are you ready for your next question? Yes. So have you all heard of Mullerian ducts? PMT में पढ़ा है? Yes ma'am, no ma'am. अच्छा, so अब मैं आपको एक नई चीज सिखाऊंगी. क्या हम ऐसे क्वेश्चन आंसर कर सकते हैं जो हमने कभी पढ़े ना हो या सुने ना हो? So let's just hear it out. You have to learn the art of MCQ solving as well. So question for first year. So we'll call it as HOTS, higher order thinking. So think and tell me. All the following are derived from Mullerian ducts. All the following are derived from Mullerian ducts except beta G. Except. ठीक है? Option A, uterus. B, ovary. C, fallopian tube. D, vagina. So maybe आपने Mullerian duct नहीं सुना था, but let's see if you can answer. So yes. All right, so I'll give chance to one boy and one girl this time. So maybe stand up, beta. What is your name, bacha?
I'm Ansh Arora.
Ansh? Okay, Ansh. I'm glad that you're wanting to answer. Batao.
Ovary.
Okay, let me hear the girl out as well and then I'll tell you. Hanji, beta. So yes, maybe you can answer. Anybody. We'll give chance to everyone. You also think it's ovary? Okay, you want to also try? Try. Tell me. And anyone else wants to give it a try? Okay, he wants to give it a try. Oh, I'm so sorry. I just neglected. I thought there are no first years here.
Vagina.
Okay. All right. So now see, this is what is going to happen in real exams as well. Okay. You will know a lot of questions, but there would be some questions which you probably don't know. But some students will be able to even get that right. Not because they knew it, but they knew how to rule out. So can you tell me what was different here? So when you talk about uterus, fallopian tube, vagina, they're all what? Female internal genitalia. But what about ovary? It's a gonad. It is completely different. So do you think they can have a common origin? No. So the correct answer is what? Ovary. So maybe our final year bright bachas tell me ovary kahan se aata hai. That's an MCQ for you as well. What is the embryological development of the ovary? No. Gonadal ridge. सबसे आसान है. Gonad comes from gonadal ridge. और ये आपके INICET के MCQs हैं. ठीक है? So do you understand now that sometimes you don't have to know everything to do things right. You have to know something and use that basic information to answer the question. So a huge round of applause for Ansh. And there was a girl there. Who was the girl? I forgot her name. Gauri. Very well done. So did you apply the same logic? And what about you, Ansh? Did you apply the same logic? Excellent. So excellent thinking. Very nice. So team 6, finally तुम्हारा number आ गया. Are you ready? Yes. So your question is, 79-year-old man is brought to his GP by his daughter, who says that he is getting very tired and lost interest in life. He has malaise for 5-6 weeks. He has lost weight, which is a few kilograms, and there is exertion, tiredness for a year. What are the other things? No other significant medical history. He smokes 20 cigarettes a day and takes alcohol. Okay, occasional paracetamol intake is there. He lost his appetite over 1 month. Sleep has been disturbed, and 2 or 3 occasions by sweating at night. No relevant family history. He's a shopkeeper. So examination findings have been given to you. And apex beat beta G is displaced 2 centimeters from the mid-clavicular line. On auscultation, there is a grade 3/6 ejection systolic murmur radiating to the carotids. A soft early diastolic murmur audible at the left lower sternal edge. No abnormalities in the abdomen or the nervous system. Urine is clear. Skin test urine dipstick test showed a trace of blood. And on microscopy, there are some red cells. A chest X-ray shows a slightly enlarged heart, beta G. Yes, so now I'm going to show you the investigations. I can show you these slides again as well. So these are the findings. An ECG record has also been provided to you. And your questions are, what is the most likely diagnosis? What are the 2 most important investigations and management? And can you give us 2 complications?
Your palm window is open.
I'll show you the investigations again. I'll show you the question again as well. So first is diagnosis. Second, 2 important investigations in management. Third is 2 complications.
Your palm window is closed. Time up.
I think team 2 has a pound, so if somebody can help them. So 5 for 1 and... Acha. Alright, team 4 also had... Have you checked their pounds? Okay. Okay, team 6, are you ready to answer, bacha? Tell me. Sorry, can you be a little loud? TB. Okay.
Complication biliary TB and left ventricular failure eventually.
Okay, but I know your keywords were night sweats and weight loss but do you think that there is enlargement of the heart, displacement, murmurs? I mean, an ECG finding was provided to you. So anyway, boys, I think the answer is not correct, but no problem. It's a good try. So the answer is actually aortic stenosis with regurgitation. All right, and the complications can be infective endocarditis. Okay, you have to treat with penicillin and gentamicin, and then a longer course of amoxicillin. He'll probably need a valve surgery as well. Yes, and the other complications can be heart failure, splenic abscess, mycotic aneurysms. Okay. So, and you said some of the pounces were correct. So let's see what correct pounces did we get. So from team 1. All right, that's very good. So a huge round. What part did you get correct? Good, good, good. All right. तूने बोला नहीं तो हम तुम्हें. Okay, so they have given one investigation. So you'll definitely get some marks for that. Okay, so my chota bachas, where are you? Are you ready? Are you ready? Okay, have you all heard of bar body? Yes. So now you're going to get a question and you're going to tell me how many bar bodies would you see in an individual with Klinefelter syndrome? Okay, how many bar bodies would you see in an individual with Klinefelter? So I think this time let me give one chance here. So yes, bacha. 1. Okay, what about you? 1. And what about the answers there? 2. Okay. Yes. Tell me. Bolo bachcho, khada ho gaya, tell me. How many bar bodies? 1. Okay, girls? 2. Alright, so what is the correct answer? No, the correct answer is 1. What is the karyotype of Klinefelter's? 47XXY. And what is bar body? Number of X chromosomes minus 1. So you know you are a bright batch of first year students. Do you know, okay, let me tell you why I'm saying that you're a bright batch. Do you know that this is one of the current entrance of PG exam question? And you did that right. So aren't you proud of yourself? See, you're only in first year and you're able to do questions which have come in post-graduation entrance exam. So a huge round of applause to all of you. Well done. So are you giving them the prizes? All right. Come. And I think we're done with round 1. So well tried all the teams. A huge round of applause for all 6 teams, please. Well done. Best. Very well done. All right, so I'll call Dr. Sumer to carry on with the next round and maybe they can tell us the scores after the end of round 1.
The scores after round 1 are Team 1 Manav and Aditya 37.5, Team 2 Lupus 25, Team 3 Chi-Square 10, Team 4 In Stitches 32.5, Team 5 Quizzards 15 and Team 6 is 25.
Yes. So we will be calling team Chi-Square first and then we go on. Okay, so can we have the 2 members of Chi-Square please?
Okay, so welcome back, and we are now to a very exciting round called as the rapid fire round. इसमें we will have 12 questions per team, and you will have 100 seconds to answer them. कोई भी क्वेश्चन आप स्किप करोगे तो वापस आ सकते हो, गलत करोगे तो हम वापस नहीं आ पाएंगे, है ना? सिंपल है, कोई नेगेटिव मार्किंग नहीं है जैसे नॉर्मली होता है. आई कीप सेइंग द क्वेश्चंस, आपने आंसर बताने होंगे. ऑल सेट? 90 सेकंड्स. 100 भी ठीक है, कोई बात नहीं. क्वेश्चन डिस्प्ले नहीं होंगे, एक ही जना आंसर करेगा. हेलो, हाँ जी. So we are starting with the team with the lowest points first, है ना? अभी it is make or break, अभी वापस highest पे आ जाएंगे, है ना? इससे पहले हम शुरू करें. I think बीच में ऑडियो जा रहा है. I think कहीं हेलो, हाँ. तो जितने भी फर्स्ट ईयर के बच्चे अभी यहाँ पे मुझे एक क्वेश्चन बताएंगे. पेरिफेरल नर्व्स में माइलिनेशन कौन से सेल करते हैं? पेरिफेरल नर्व्स में माइलिनेशन कौन से सेल करते हैं? श्वान सेल. और ब्रेन के अंदर हाथ खड़ा करके बताओ, ब्रेन के अंदर ऑलिगोडेंड्रोसाइट. ब्रिलियंट, है ना? अब देखो, अभी जैसे आपने आंसर बताया, आपको लगा आप बहुत बढ़िया कर रहे हो, आपको सब पता है ना? लेकिन क्या होता है कि चीज़ें तो वही होंगी, आप हर बीतते हुए साल के साथ उसमें आप आगे बढ़ते जाओगे. जैसे आप आगे एमबीबीएस के अंदर आगे आओगे, आपने सोच के बताना है कोई ऐसी इन्फेक्शन, देखिए आपने अगर अब तक पढ़ा है कि नहीं, जो ऐसी वायरल इन्फेक्शन जो ऑलिगोडेंड्रोसाइट को इन्वॉल्व करती है. अब मुश्किल हो गया, है ना? तो मैं ये चाहता हूँ कि कभी भी ओवर कॉन्फिडेंस नहीं आना. जितना बच्चा जूनियर होता है उसको हमेशा लगता है मुझे सब आता है, और जितना सीनियर डॉक्टर होता है उसको लगता है भी मैं सीख रहा हूँ. मतलब समझ पा रहे? इमेंस है ह्यूमन नॉलेज जो हमें आज चाहिए, बहुत ज़्यादा है. अच्छा, एक चीज़ बता दो मुझे, अगर कोई ऐसी डिजीज़ होगी जो ऑलिगोडेंड्रोसाइट को इन्वॉल्व करेगी, तो ब्रेन का कौन सा पार्ट इन्वॉल्व होगा? हाथ खड़ा करके बताना है. ग्रे मैटर कि वाइट मैटर? ग्रे मैटर. अच्छा, कोई और? ऑलिगोडेंड्रोसाइट की बीमारी होगी तो ब्रेन का कौन सा पार्ट इन्वॉल्व होगा? एनीबडी? व्हाइट मैटर. व्हाइट मैटर इज द पार्ट मेड अप ऑफ एक्सॉन्स. एक्सॉन्स आर कवर्ड विद माइलिन, है ना? ऐसे जब धीरे धीरे सोचोगे, यू विल रियलाइज कि आप बहुत सारी इम्यून बीमारियां आगे जाके बहुत सारी चीजें सॉल्व कर पाओगे अगर उनका वाई एक्सप्लोर करोगे. विल टॉक अबाउट इट लेटर, है ना? और बात करेंगे. पहले ये टीम खड़ी है, इनके साथ क्वेश्चन शुरू करते हैं. और योर टाइम स्टार्ट्स. हाँ, मैं बोलता जाऊंगा, ठीक है? Your time starts now. Full form of iris is. Drug of choice for narco analysis is. Root value of nerve supply of Achilles reflex is. Incorrect. Most common type of E. coli. Tennis criteria. TENESSEE. Tennis criteria. Tennessee criteria. Cullen's in Obs obstetrics is. Pregnancy sign. Incorrect. Enumerate components of Gradinego triad. Triad would be three things. Most common gene or chromosome mutated in Williams syndrome. Chromosome in Williams syndrome.
8.
Incorrect. Strawberry gums are seen in.
Vaginous granulomatous.
Correct. Structure passing through a superior orbital fissure.
Lacrimal nerve, nasociliary nerve, then frontal nerve.
Incorrect. You can complete the answer if you want to complete.
Ophthalmic nerve.
Okay. Okay. So I don't. I think we cannot give the points here. Huh? So only one they could get correct. So I'll tell you the answers. Full form of iris was immune reconstitution inflammatory syndrome. Drug of choice for narco analysis was thiopental sodium. Root value for Achilles reflex was S1, S2. Most common E. coli was 0157H7. Tennessee criteria was for HELP syndrome, HELLP. Cullen in obstetrics was ecchymosis of umbilicus in ectopic pregnancy. Ectopic pregnancy was the keyword, not the pregnancy. Ectopic. Hemoperitoneum. Ectopic was the answer. Grady-Nigo triad was ear discharge, sixth nerve palsy, fifth nerve palsy. Most common gene or chromosome in Williams syndrome was chromosome 7. Strawberry gums, you've answered it correctly, was granulomatosis with polyangiitis. Superior orbital fissure was third nerve, fourth nerve, fifth nerve, sixth nerve, ophthalmic veins. Blue, questions that you could not get were blue staining of PM staining is seen in which poisoning? Answer was cyanide. Enzyme deficiency in Tangier's disease is, answer was alpha lipoprotein deficiency. So I think they could get only one correct. So the next team will be, big round of applause. And important thing is always trying. Don't worry, don't think that we are winning or losing. हमेशा सीखने खेलने से ही सीखते हैं हम लोग, है ना? अच्छा, जब तक बाकी जो फर्स्ट ईयर है मुझे बताएंगे ब्रेन में कौन से पार्ट में आपने स्कूल के समय में एक्वेडक्ट ऑफ सिल्वियस पढ़ा था? एक्वेडक्ट ऑफ सिल्वियस नहीं चाहिए, माइक चाहिए। हाँ बच्चे, यस, she's saying midbrain, which is absolutely correct. She gets a round of applause and a prize. Okay, so the next team, this. Okay. Are you all set? All set to go? Okay. Your time starts now. Full form of PCPNDT Act. Correct. Drug of choice for BPH. Correct. Nerve supply of knee joint. Nerve, routine, nerve. Most common type of atrial septal defect. Most common type of it. Wells criteria are used in. Correct. Sagging rope sign. Sagging rope sign. Enumerate components of Sandblum triad. Most common chromosome involved in Angelman syndrome. Chromosome mutated in Angelman syndrome.
Chromosome 13?
Incorrect. Strawberry gallbladder is seen in name the condition.
Mirizi syndrome.
Incorrect. Structures passing through greater sciatic foramen below piriformis. One structure passing, any four you can tell. Greater sciatic foramen below piriformis. PM staining in copper. Color, correct. See, they got it correct. So they get, I think, 4 or 5 correct, I think. 4 correct. We'll go through the questions once more to check. Okay. So full form for PCPNDT, they got it right. It is preconception prenatal diagnostic technique. The first year students, you can, when you go to any ultrasound clinic, you will see it written outside it. Drug of choice for BPH was tamsulosin, which is absolutely right. They answered it correctly. Nerve supply for knee joint was femoral nerve. Most common type of atrial septal defect was ostium secundum. Wells criteria were pulmonary embolism. Sagging rope sign was Perthes disease. Components of Sandblum triads were melena, obstructive jaundice, and biliary colic. Angelman syndrome, chromosome 15. Strawberry gallbladder was cholestrolysis, and structures below below piriformis through greater sciatic foramen was sciatic nerve, inferior gluteal nerve, artery, vein, pudendal nerve, internal pudendal. So these were the structures that you could have answered. PM staining in copper was dark brown yellow. You got it right. The only question that you could not get was what deficiency in type 2 hyper beta lipoproteinemia? What deficiency is seen in type 2A hyper beta lipoproteinemia? The answer was LDL receptor deficiency. Okay. So well done. I think they've gotten 4 correct. Well done. So we come to the team 3. Team 3, let me just track the question paper. Okay. So the next team will again have such a, so rapid fire, you will see, when you see the candidates, आप देखोगे कई बार उनको आता था, लेकिन व्हेन यू पुट देम अंडर स्ट्रेस ऑफ टाइम वो भूल जाते हैं। ये असली एग्जाम में भी आपके साथ हो सकता है या पहले हुआ भी हो, मैं चाहता हूँ, लेकिन इसके प्रिजनर नहीं बनना आपने। कई बच्चे मेरे पास आते हैं कि जैसे पीएमटी के समय पे मैं गलत कर गया, मेरे और अच्छा कर सकता था, तो यू कैन ऑलवेज इंप्रूव, हमेशा इंप्रूव कर सकते हैं, है ना। रेडी, ऑल सेट, योर टाइम स्टार्ट्स नाउ। व्हाट इज द फुल फॉर्म ऑफ CCD? Drug of choice for motion sickness. Name of the drug. Okay. Nerve supply of pectineus muscle. Incorrect. Most common type of ventricular pre-excitation syndrome.
Ventricular tachycardia.
Incorrect. Nugent score is used in
Breast cancer, DCIS, radiotherapy.
Incorrect. Pemberton sign is seen in Pemberton sign. Okay, we can give it to you, man. Correct. Enumerate components of Mechler's triad. Most common chromosome mutated in Charcot-Marie tooth disease. Chromosome. Incorrect. Agent Orange causes. Okay, we give it to them. Leukemia, correct. Structure passing through lesser sciatic phenomenon. Incorrect. Mucous membrane staining in arsenic poisoning. You can answer this. Mucous membrane staining in arsenic poisoning. What color? Incorrect. So let me tell you the correct answers now. Full form of we will just check again. Full form of CCD was considerable conduct disorder. It was not cafe coffee day. Drug of choice for motion sickness was scopolamine. Scopolamine. Nerve supply of pectineus muscle was obturator. Obturator. Most common type of ventricular pre-excitation syndrome was WPW syndrome. Nugent's score was bacterial vaginosis. Pemberton sign goiter, we gave it to you, that is one correct you had. Mechler's triad was vomiting, lower thoracic pain, subcutaneous emphysema. Chromosome in Charcot-Marie tooth disease was chromosome 17. Agent Orange causes CLL. You said leukemia, we are giving it to you, so two answers you got right. Lesser sciatic phenomenon, obturator internal muscle, pudendal nerves and internal pudendal vessels are passing through it. Mucous membrane staining in arsenic poisoning is white particles. Enzyme deficient in AFLP was the question that you could not get. The answer was LCHAD. Okay, so they got two correct. Okay, well done, beta, well done. So now we come to the next team. So team 4, are you all set? Mike. Okay. I need to use this. Okay. Are you all set? Are you? Yes, sir. Hello. Are you all set? Okay. So question number 1, your time starts now. Full form of the word FOOSH. FOOSH. Drug of choice for cervical cancer. Sensory receptor for joint angle change. Sensory receptor. Most common age group for IBS. Correct. Milan criteria are used for MILAN. Incorrect. Turtle sign is in. Correct. Enumerate components of Anderson's triad. Most common chromosome mutated in Wolff-Hirschhorn syndrome. Incorrect. Orange tonsil are seen in. Structure passing through foramen lacerum in adult.
Jugular bulb.
Incorrect. Membranous glomerulopathy seen in which poisoning?
Cadmium. And mercury.
Mercury, correct. Enzyme deficiency in Krabbe's disease.
Pass.
Okay. Any question you want to come back to? First question, full form of FUSH. FUSH. Okay. So time's up. So let me just go through the answers. Hello. So let me just go through the answers once more to see what were the correct answers. Full form of FUSH was fall on outstretched hand. Drug of choice for cervical cancer was cisplatin. Sensory receptor for joint angle change was Ruffini corpuscles. Most common age group in IBS is middle age group, you got it right. Milan criteria were for transplant eligibility in cirrhosis and hepatocellular cancer patients. Turtle sign shoulder dystocia, you got it right. Enumerate components of Anderson's triad was abdominal rigidity, tachypnea, subcutaneous emphysema. Chromosome in Wolff-Hirschhorn syndrome was chromosome 4. Orange tonsil was seen in Tangiers disease. Structure passing through foramen lacerum in adult was, I think, nil. None. Nothing passes through the. Membranous glomerulopathy is seen in which poisoning? Answer was mercury. You got it right. I think they got 3 correct. Enzyme deficiency in Krabbe's disease was galactosyl ceramidase. I think we did not reach to this question. So they got 3 correct. Well done, beta. Well done. Okay. So now what we'll do is, we will go to the team 5. Team 5, are you all set? 4. Okay. In my count it is 5, but anyhow you can come. All set? Excited? Yes, very good. So what we'll do is, I'll tell you when the time starts and then I start asking. So your time starts now. Full form of BPD in psychiatry. BPD. Drug of choice for Alzheimer's disease. Nerve root of nerve to latissimus dorsi. Nerve root.
C5. Next.
Most common site for intra-abdominal abscess. Correct. CHAD S thromboembolic risk in patients with non-valvular. I think there's some confusion. Okay. Okay. We'll give them extra time. PIS-CASEC sign is seen in PIS-KACEK. Enumerate components of O'Donoghue triad. O'Donoghue triad in the knee. Okay. Chromosome mutated in Stickler syndrome type 2. Incorrect. Can opener technique is used in can opener.
Sir, in cataract surgery, it is used in capsular.
Yeah, name the. What are we doing?
ICS. We are removing steps. There's can opener. There's pin.
Structure passing through sinus of Morgagni.
Tensor villi palatini and levator villi palatini.
Correct. Greenish blue froth from mouth and nostril in which poisoning? Greenish blue froth from nose and mouth in incorrect. Enzyme deficiency in HERS disease. Okay, time up. So we have been able to see all the questions. So we will just tell you the correct answers once the initial sheet is ready. Okay. I'll just tell you the correct answers. Full form of BPD was borderline personality disorder. Drug of choice for Alzheimer's was donepezil. Nerve root for nerve to latissimus dorsi was C6 to C8. And intra-abdominal abscess was pelvis and hepatorenal recess. So we gave it to you. CHAD S2 score was assessing thromboembolic risk in non-valvular AF. Pis-Kasek sign was one half of uterus is enlarged, then other because of implantation. Components of O'Donoghue triad were ACL tear, medial collateral ligament tear, and medial meniscus tear. Footballers triad, if you remember. Chromosome in Stickler's syndrome was chromosome 1. Can opener technique was anterior capsulotomy. Structure passing through sinus of Morgagni were ascending palatine artery, levator villi palatini, eustachian tube, ascending pharyngeal artery. You got it right. Greenish blue froth from mouth and nostril, in which poisoning was copper. Enzyme deficient in Hirsch disease is liver phosphorylase. So I think you got 2 correct. है ना? 2 correct. Cataract वाला रह गया. हाँ. I think they need a big round of applause. Okay. So we come to the final team now for the rapid fire. Okay, all set? Okay. So what I'll do is I will tell you the questions, and there will be a timer going on. I am sure you already know it. So your time starts. Take a mic, I think. Mic. Mic will be better. Huh? Achha, chal we see. What your time starts now. What is the full form of ASRM? Drug of choice for infantile spasm without tuberous sclerosis, I think. ACTH, correct. Dermatome posterior half of skull. Correct. Most common inherited bleeding disorder. Correct. Glasgow Blatchford score is used in. Incorrect. Aaron sign, AARON, Aaron sign. Correct. Enumerate components of Trotter's triad. Trotters, Trotteter. I think correct. We'll give it to you. Most common chromosome mutated in Winchester syndrome. Gene, I think. Most common gene mutated in Winchester syndrome. Splashed tomato appearance is seen in eye. See? Splashed tomato in eye. Correct, CRVO, correct. Which structure is attached to antero-superior to mandibular foramen? Blood-stained frothy fluid and mucus from nose and mouth is seen in. Blood-stained frothy fluid, mucus from mouth and nostril indicates. Incorrect. So, it indicates strangulation. Strangulation. Okay. So, I'll tell you the correct answers. I think they got a lot of them correct. Full form for ASRM was American Society of Reproductive Medicine. Drug of choice for infantile spasm, WO, tuberous sclerosis, ACTH. You got it right. Dermatome posterior half of skull was C2. You got it right. Most common inherited bleeding disorder, von Willebrand's disease. Correct. They got it right. Glasgow Blatchford score was to assess need for intervention in upper GI bleed. Aaron sign was referred pain in epigastrium on pressure over McBurney's point. They got it right. Trotter's triad was neuralgia of the mandibular nerve, palatal palsy, and CHL. And most common gene in Winchester syndrome was MPP14, MPP2. Splash tomato was ischemic, CRVO. They got it right. Structure attached antero-superior to mandibular foramen was spinomandibular ligament. Blood-stained frothy fluid was strangulation, I told you. Deficiency of dash in Brown-Schindler's disease. Any guesses? Deficiency of peroxismal matrix protein. That was the answer. So well done, I think. At the end of this round, I think we would have a lot of changes. Let's see.
Team 1, 97.5. 45, team 3 20, team 4 52.5, team 5 55, and team 6 55.
By the time we start the next round and we get it going, first years बताएंगे which part of the brain is the sensory relay organ of the brain. Sensory relay organ, हाथ खड़ा कर बताना. Thalamus, very good. अच्छा, एक और क्वेश्चन आ रहा है अभी आपके लिए, देखते कोई पता. चॉकलेट देते जाओ बच्चे, कहाँ के चॉकलेट वाले बच्चे? चॉकलेट देते हो? अच्छा, एक ये बताना है आपने, देखिए कोई बताता है तो ऑर्गन ऑफ कॉर्टी, कॉर्टी, CORTI पढ़ा था स्कूल में? अगर पढ़ा था तो वहां से कौन सी नर्व अराइज करेगी? ऑर्गन ऑफ कॉर्टी. हाँ, कौन सी नर्व, नर्व का नाम बताना है. हाँ बच्चे बता. हाँ हाँ, ऑडिटरी, उसको और क्या कह सकते हैं, कुछ और कहते हैं हम ना, कॉक्लियर. कॉक्लियर, वेल वेल डन. आई थिंक शी डिजर्व अ गुड बिग चॉकलेट एंड अ बुक एज वेल फॉर प्राइस, है ना. वेल डन. अगला जो राउंड है थोड़ा सा रिस्की राउंड है. इसमें अब क्या करना है हमने, अब मैं उसका राउंड लेके आ रहा हूँ यहाँ पे, स्क्रीन से गायब हो गया, आ गया. इस राउंड का नाम है रिस्क है तो इश्क है. इसके अंदर टोटल 6 क्वेश्चन होंगे. सारे क्वेश्चन बच गए. पहले तो नहीं दिख रहा, डुप्लीकेट कर दिया इसने. अच्छा, डुप्लीकेट नहीं करना. हाँ ठीक है, ठीक है, ठीक है. ठीक है ना? हाँ जी, हाँ. So this round would have total 6 questions open to all the teams, and at first one hint will be provided for each question. On the basis of the hint you have to bet a amount between 20 to 50. ठीक है, आपने अपना 20 to 50 मार्क्स में से कुछ भी बेट कर देना है. Then the team will get to read out the question. 1 minute will be provided to answer that question. Answer has to be written on a sheet and shown to the organizers. If you get it right, you will get the points that you have put on the bet will get added to your score. If you get it partially correct, you will get no points. Okay, but if you get it incorrect, half the points that you have bet will be deducted. मतलब अगर ठीक बताओगे तो जितना बेट लगाओगे उतने नंबर मिलेंगे, गलत बताओगे उसका हाफ कट जाएंगे. अगर पार्शियली करेक्ट होगा तो ना कुछ मिलेगा ना कुछ कटेगा, और टोटल 20 से 50 के बीच में बेट लगा सकते हैं. ठीक है, मैं पहले क्वेश्चन दिखाऊंगा, कोई भी उसमें हाथ खड़ा करके उसके अंदर बेट कर सकता है. ठीक है, ठीक है. सबसे पहला क्वेश्चन का हिंट ये है, आंसर लिखने हैं लेकिन आपने, क्योंकि पास करना है क्या, उसके बाद पास करना है. अच्छा अच्छा, सबके लिए ओपन है, सभी आंसर लिख सकते हैं, लेकिन बेट कैसे करेगा? अपना बेट ऊपर लिखेंगे. अच्छा, मतलब कोऑर्डिनेटर्स विल चेक इट आउट, है ना. ऑल सेट टू गो. आई एम शोइंग यू द फर्स्ट हिंट. फर्स्ट हिंट देखो मेरे साथ, ये है, हाउ वेल कैन यू फॉर्म अ एसोसिएशन बिटवीन द इमेजेस टू रीच टू अ डायग्नोसिस इज द हिंट. ठीक है, नाउ यू हैव टू पुट योर बेट्स ऑन. After you put your bets on, you can write your answers when I show you the question.
Team 1 20 points bet कर रही है.
ठीक है, 4 इमेज होगी, जोड़ना होगा, आंसर आना है, अपना बेट लगाओ. जितना रिस्क खेलोगे उतना बड़ा जीतोगे. ऑल सेट. जो बहुत ज्यादा टाइम लगा रहा है उसके सारे नंबर बेट पे लगा दो. बहुत आसान है, बिल्कुल मैं देख पा रहा हूं. लगा दो. हाँ जी, कितने नंबर लगा दिए बेटा आपने? सो एक ही टीम है जिसने 50 नंबर बेट पे लगाए हैं, बाकी 20-20 पे खेल रहे हैं और कई लोग तो बेट लगाने से भी डर रहे हैं. आर यू ऑल सेट नाउ? चलें, देखें, रेडी? ऑन योर मार्क्स, गो. So I'm going to show you a very, very interesting image. You just need to tell me how do you connect these to all the images shown to you. On your marks, let's go.
You just have to write, no prompting.
Just connect them all. It's a very simple one, and it's a good thing that you have bet 50 marks. Audience can also start thinking about it. And your time is? Is somebody taking care of the time? Yes. Yes. So your timers are behind you. So big round of applause for the organizing team before we forget, and the timers and everybody doing it, because आसान नहीं ऑर्गेनाइज करना. अभी फर्स्ट ईयर में लग रहा होगा बहुत आसान है, जब अगले साल अपनी बारी आएगी बहुत मुश्किल लगेगा. And the time is up. Let's see. Any of the teams have got it right? Please. Team 5 has scored minus 20. Minus 10. अच्छा हाफ माइनस करें, जितना बेट लगाया उसका हाफ करेंगे. हाँ जी, anybody? Minus? They have bet 40. Minus 10. Team 4 minus 10. Team 3 has scored plus 50. Big round of applause. Team 2 and team answers any score? उन्होंने खेला ही नहीं. Wrong है तो minus कर दो ना, जल्दी से बताओ. हाँ? So the correct answer was, any guesses from the audience? The correct answer was called as nutcracker syndrome. If you have compression of the left renal vein between the superior mesenteric artery and aorta, you would have varicocele, which was shown there, a nut was shown there, abdominal pain was shown, hematuria was shown. So left gonadal vein drains into the left renal vein, hence varicocele is formed. So next, are you ready for the next hint? On your marks, get set, go. Hint is, when I say you will need ECG for diagnosis, will you be able to guess the condition?
Place your bet.
Team 6, Team 5, Team 4, Team 3, Team 2, Team 1, फिर Team 3 ने 30 लिया और सबने 20 किया.
Okay, so are your bets placed? Ready? I'm going to show you the question now. So this is what you have to identify to make sure that your bets are worthy. A 4-year-old is brought to the emergency with complaints of syncope. He has history of recurrent syncope, sometimes without any precipitating factor, sometimes precipitated by startle events like ringing of alarm clock. Speech and language development is impaired. He is able to understand and respond only when examiner was in close proximity to the patient. Consultant ordered a single investigation, ECG, which gave a diagnosis X due to abnormality Y. Identify X and Y. Okay, so any of the teams start thinking of only one investigation was done, ECG, which make a diagnosis X caused due to Y. Syncope and speech and language is impaired is a good clue. he was able to understand only when the examiner was in close proximity to the patient. दूर से नहीं पता चल रहा था. सोचो सोचो सोचो. Time's up now.
Team 5 minus 10. Team 2 Team 2 0. कर दिया मैंने? If not attempted, sir, negative. Negative to the हाँ सिर्फ I think इनका partial correct है. Minus 10 minus.
Okay. Only one team has got it partially correct. Team 2. Team 2. So we'll give them half the marks. Half the marks. Or whatever they had bet. Okay. Acha, 0. Usse 0 milega. Acha. All the teams are keeping a close eye on each other. So let me tell you the correct answer now. Correct answer was Jervell and Lange-Nielsen syndrome, JLNS, inherited disorder characterized by deafness. That is why he was not able to hear. Present at birth, congenital, occurring in association with abnormalities affecting the electrical system of the heart. Classic presentation is a deaf child, syncopal episodes during stress, exercise, fright, characterized by mutation in KNCQ and KNCE1 gene, which leads to prolonged QT interval causing arrhythmia presenting as episodes of syncope. Okay.
इसका एक और बहुत close differential है जो I think नीति ने लिखा था बुगाडा, but बुगाडा will never ever present with sensory neural loss and that is why it is correct. दोनों ही same है, दोनों congenital long QT syndrome ही है, but sensory neural loss नहीं होता. ये सबसे बड़ा ये difference था, but they got very close to that answer.
But we cannot give him them. तो पास आने से बात नहीं बनेगी, बिल्कुल correct answer आने से बनेगी. Okay, all set to go for the next hint. Ready? What comes to your mind when I say candida? Is the question. ठीक है? Please place your bets so that you know. मेरे को लग रहा है आसान है इसमें तो मतलब मैं कह रहा हूँ लगा दो सब बिल्कुल. Betting round में ऐसे ही होता है मतलब या तो जीतेंगे या मतलब बिल्कुल खत्म. रिस्क है तो इश्क है. ओके कई टीमें मैं देख रहा हूँ सिर्फ 20-20 रुपए लगा रहे हैं. ऐसे नहीं जीतेंगे कुछ बात नहीं बनेगी. करें आगे शुरू. ऑन योर मार्क्स सबका बेट लग गया है. द क्वेश्चन इज दिस. पेशेंट प्रेजेंटेड विद एड्रीनल insufficiency, chronic non-invasive mucocutaneous candida infections. Upon lab infection it was found calcium is 3.5, PTH levels are low. What is the most probable diagnosis? What is the normal physiological process that is defective in this patient? Two parts to the question. All set? I can see a lot of people are writing and cutting and writing and cutting. Okay, by the time first years, which structure in the brain produces CSF? CSF is produced by CSF, cerebrospinal fluid, is produced by which structure in the brain? मतलब ऑप्शन कैसे बताऊँ तो आसान आ जाएगा. ये तो पढ़ा था आता था ये पीएम नहीं आता. CSF पता है ना ब्रेन में जो cerebrospinal fluid. Okay, okay, time is up.
Team 6 minus 20 minus 10 minus 15.
So, any of the teams has got it right? Team 1 has got it correct. So, all correct, they get plus 20. मैं बोला था ज़्यादा marks लगा देते मतलब नहीं माने नहीं चलो let me show them the correct answer now. Correct answer is autoimmune polyendocrine syndrome type 1 caused by deficiency in iron autoimmune regulator protein which affects the process of negative selection in thymus medulla causing T cell that recognize self antigens to escape tolerance and mount the immune response against the body's own cells, characterized by chronic mucocutaneous candidiasis, hypoparathyroidism, adrenal insufficiency, recurrent candida infections, which were there in the question. All set to go for the next hint? All set. The hint is you will have to connect a set of images. I think at the end of this round, we'll give these girls some extra marks for butting actually. Ready? On the marks we go. You have to connect them, give us the diagnosis. Something in the heart, spine, face, blood, hand. First years, the CSF is produced by choroid plexus first years, choroid plexus. I think they forgot. Okay, first year I'll put the level even low down now. Which valve is present between left atrium and left ventricle? Name the valve. Left atrium and left ventricle. Yes. Huh? Not bicuspid. Left atrium and left ventricle. Name the valve. Mitral valve is correct. She gets one more chocolate. Very good, beta. Very good. You're doing very well. Okay, the correct answers. Anybody? Time is up. They got it correct. Well done. They had put the maximum marks on the bet and they have got it right. I think that's good strategy. Other teams? क्या कौन सा वाला आधा करेक्ट है पहला वाला कि दूसरा वाला दे देते हैं वो दूसरा वाला ज़्यादा मुश्किल लग रहा है ठीक है give them okay the correct answer is diamond black fan anemia characterized by triphalangeal thumb macroovalocytes congenital heart defect cleft lip Klippel-Feil syndrome where there is a fusion of two or more cervical vertebrae. So I'm coming to the next hint directly. Let's say it go and this is your hint. Place your bets. Mother and child. Mother and child.
Team 6, Team 5, Team 4, Team 4 20, Team 3, Team 3 30, Team 2 20, Team 1 20.
Okay, shall I show the question now? Are all the bets on table? Yes, let's go. The question is, newborn is being evaluated in the nursery. Patient was born at term via spontaneous vaginal delivery to 23-year-old woman. Mother developed dark terminal facial hair, deepened voice during pregnancy. Delivery is unremarkable. Patient vital signs are within normal limits. Examination shows ambiguous genitalia, clitoromegaly. Lab studies reveal elevated serum levels of testosterone, androstenedione. Karyotyping testing shows 46XX genotype. Ultrasound of the newborn is normal sized. Uterus is there. This infant presentation is most likely due to deficiency of which of the following enzymes? Explain the findings. I'll invite Dr. Deepti to explain the question further.
Any other team which got all correct? Wonderful. All right, so we'll give a chance to them to explain. So tell me, what have you written? So the enzyme?
So basically, the testosterone and androstenedione produced by the fetal adrenals is not being able to convert into estrogen.
Very well.
Excess of testosterone.
Yes. So, all right. So that's absolutely right. It is aromatase deficiency. So, you know, the placenta cannot make its own estrogen. It uses the androgens to make the estrogen, and for that, it needs the enzyme aromatase. So, when the aromatase is not there, there is an androgen excess, which leads to virilization in the mother as well as in the baby, right? And so clitoromegaly is the hallmark of virilization, and that tells you that there is androgen excess. So I think it was an easy question, but well done. So very well done. Okay.
Okay, so the final hint, I think this is the final hint. I am showing you the hint, ready to go. This was the answer of the previous question. How many causes can you think of hypocalcemia? We will show you one in the next slide. Are you ready to place your bets? इसमें लिमिट नहीं होनी चाहिए, नो लिमिट टेबल होना चाहिए था, ये तब ज्यादा मजा आता. Last question in this round. It will be a cause of hypocalcemia and you need to answer it. Ready? Shall I show them the question? Are all the bets placed? Okay, now see your question now. Short-statured boy presented to the OPD. He has following finding on the sole of his foot. They are shown on the screen. Also seen in few other places all over the body. Fourth and fifth digit seem relatively shorter than the rest. Very important. Boys' serum studies show sodium 136, potassium 4, bicarb 20, calcium 3.5. Normal ranges are given on the side. Phosphate is 1.4. What is your diagnosis and what is the gene mutation? Okay. Something in the hand, something in the serum level, serum studies, some skin finding, you can just put them all together. This is the last question of this round. Any of the team members have answered? Team 1 has already answered it correctly. Other teams, get set. Time is up. Hello, hello.
Okay, so I think these two teams got it partially.
Only two teams got it partially correct. Only one got completely correct. So we'll give marks only to the completely correct. And
They got 0.
Zero. Yeah.
They get the
How much did you bet? थोड़ा जोर आगे बढ़ना चाहिए था. चलो, let's see the correct answer. The correct answer was Albright's hereditary osteodystrophy, which is also called as the pseudo hypoparathyroidism type 1A, PHP 1A. We had that short stature in the question, obesity, round face, subcutaneous ossifications were shown to you, short fingers and toes. everything was mentioned in the question. I am sure most of you would now know the answer. The condition is inherited in autosomal dominant manner due to genetic change in gene as gene. Okay. So by the end of this round, let's see the scores. By the time we have the scores, I'll take a moment to tell you only two things. है ना? दो चीज़ बताऊंगा and we'll give a prize to the people who have been the part of the organizing committee of this quiz. I'll just invite Aryan and one more bacha with me. All the bachas who've been working so hard to do this quiz and the entire organizing team. And I want all the participants to give them a big round of applause. Yes. Where is the bag? So we have one bag for all. Acha, one bag for each of them. Right. हाँ. Acha, we'll have now after this round, me and Dr. Deepti will take your leave and your quiz masters will continue. But I want to tell you, all of your brilliant students, and you've already won the game when you participated. Congratulations. सिर्फ दो ही बातें याद करनी है. हर वो चीज़ हो सकती है जो आप इमेजिन कर सकते हो. लिमिटिंग फैक्टर आप क्या इमेजिन कर सकते हो, जो आप सोच सकते हो वो हो जाएगा, लेकिन सोचोगे नहीं तो कुछ भी नहीं होगा. दूसरी है जो मैं एक ही चीज़ कहना चाहता हूँ, आप क्योंकि आप सब बच्चे पार्टिसिपेट कर रहे हो, जब भी आप कुछ भी करोगे ना, पहले नेगेटिविटी आएगी, करूं कि ना करूं, करूं कि ना करूं. अगर नेगेटिविटी को हरा देंगे, हर चीज जीत पाएंगे, है ना. अपने अंदर नेगेटिविटी नहीं आने देनी. इफ यू पुट 100% ऑफ योर टाइम ऑन ऑप्टिमिज्म, हर बार जीतोगे. थैंक यू वेरी मच. इट वाज फन टू होस्ट दिस क्विज विद यू. मैं आई विल रिक्वेस्ट डॉक्टर दीप्ति, मे बी वी कैन हैव वन पिक्चर विद द पार्टिसिपेंट्स एज वेल. एक फोटो पार्टिसिपेंट्स के साथ.
Participants, please remain seated to their same places. You will be getting the refreshment boxes.